In January this year, Atul Gawande became Assistant Administrator for Global Health at USaid. He's a renowned surgeon, a writer, and public health leader. I also know that he used to write for the New Yorker sometime in his past. He's joining us now in studio to discuss, among other things, the economic impact of joint health programming and how health programs are a critical part of job creation, for example, here in South Africa. Dr. Atul Gawande, welcome to Today on eNCA. Thank you very much for coming in.
It's a great pleasure. Thank you for having me.
When did you arrive in South Africa?
So I arrived yesterday morning, so not very long ago.
Yeah, you have such an illustrious past. I mean, you're a medical man yourself, you're a surgeon, but you've been a writer, you wrote for the New Yorker, you've done a lot of other things. We don't have a lot of time to go through them. This has been a challenging job for you since January, and how challenging has it been?
Well, my job is to lead U.S. investment in global health, and of course we've had the COVID pandemic. Then we had the Ukraine invasion. The invasion by Russia into Ukraine led to the collapse of the health system there, where we were offering response. We've had 2 Ebola outbreaks. We've had monkeypox as a public health epidemic, and now the surge in Uganda of Ebola and the ongoing needs here in South Africa. So
yeah, you were in Uganda before
job.
you came to South Africa. You were in Uganda?
That's right.
In terms of the Ebola outbreak, how bad is the situation?
It's a serious outbreak. My assessment after having spent 3 days on the ground there, including going to the epicenter in the Mubende district and Kasanda district, is that it is we've seen Ebola outbreaks go from 10 cases to 100 cases to thousands of cases, and it has been controlled, but it is not fully controlled. Kampala last week recorded more than a dozen cases, and so that's a dangerous situation. I'd say this week, however, the response in Kampala has grown stronger. The government of Uganda is quite capable, and the U.S. has pushed in $22 million. I
was about to ask, what is USAID's role in this? So about $22 million, and that is to help with what?
So that has been in fielding contact tracing, diagnostics, field workers. We are supporting WHO, UNICEF, and many other partners that are supporting the government in the response on the ground. What I can tell you is, we all remain concerned about several things. Number one is getting the counts down, and the counts seem to be coming down this week, and that's a good sign. Also, I confirmed at the border that the screening at the border, so international travelers that screening is there, and I was impressed in Johannesburg, my flight from Kampala, that the airport authority here checked all of our temperatures before entering into South Africa. So those are reassuring signs. Okay,
so that's Uganda. Now you are here, South Africa. Before we talk about us and what brings you here, I just want to get a sense from you. What are USAID's global health priorities today?
Well, number one, the global priority was get COVID to become a manageable endemic respiratory illness. And we will be tested in the next couple of months because the surge from the winter is coming. But vaccination rates, I believe, have risen to levels that we will see deaths at a much lower level. And we will find out if the protection's strong. Second is being able to protect and respond to outbreaks as they've happened to prevent the next pandemic. And we have seen, as I mentioned, 2 Ebola cases, Marburg virus, even deadlier than Ebola in Ghana. We are supporting with large investments, including in South Africa, the ability to detect, prevent, and then respond to outbreaks. And then the third goal is our health systems have not fully recovered since the pandemic. There has been an enormous impact. And in South Africa, that has included places where HIV protection has gone down. TB cases are way up. And we're wanting to make sure that we support South Africa.
I mean, it was very
closely.
difficult during the lockdown for people to access some of those services, including antiretroviral treatment for HIV/AIDS, and hence you had the cases. Now, what is the role then of what brings you to South Africa? Firstly, let me say that I didn't start there. And what is the role of USAID in assisting our public healthcare system is in a crisis?
That's correct. Around the world, public health systems are in a crisis. You got it exactly correct that although now public health systems are recovering, they were damaged in the course of the pandemic. Number one, healthcare workers got sick, and many left, burnt out. Number two, economies were hurt by the pandemic in a significant way, so budgets ended up shrinking. We've been making investments here for quite a long time, and what we know is that the health of South Africa is essential to the economic success of South Africa. South Africa's success is essential to Africa's success, and Africa's success is essential to the world. So we have been here especially investing in the biggest killers. HIV, for example. In 2005, the average life expectancy in South Africa was only 53 years. You cannot have a successful economy if the average person dies in their middle age like that. The programs we've invested in through our PEPFAR program in the U.S. government and at USAid has cut the death rate from HIV and the infection rate by half. And so in just the last 10 years, life expectancy has gone to 64 years, and there's more to go.
And how much have you been putting in as USAID into the South African health system in those kind of programs and others?
Yeah, I mean, to put it in real terms, we are supporting the employment of 15,000 health workers in the country. We've invested this year alone 6 billion rand because we believe in the success.
You're supporting the employment. What about skills? Because one of the issues we face in our public healthcare system is lack of skills. We've had a flight of skills, an exodus of skills as well.
Yes, this is a critical part of what we recognize as well. So in supporting health workers, we're supporting their skill development as well, both training to create health workers who can have that capability to earn an ongoing living, training that enables them for the rest of their life to have those kinds of skills. And then second, among the patients, for example, one of the highest risk groups for getting HIV infection in South Africa are adolescent girls. And enabling those girls to not only have protection against HIV, treatment if they have HIV, we're also enabling them to have skills, getting vocational training, whether it's for beauty shops or other jobs, so that they are not just living, they're succeeding.
Yeah, if you had to give us a breakdown of your USAID budget for South Africa in the healthcare space, where does the majority of the money go to? Does it go to, for example, training and skilling and employment, or does it go to tackling the issues of disease? Does it go to research? I mean, we have wonderful scientists in this country.
Amazing scientists. I just came from the WITS program in their Reproductive Health Institute, where we were looking at what is the continent's and perhaps one of the world's most important vaccine research centers. I came from also seeing the program in Hillbrow Community Health Center that we've been supporting. So, you know, the biggest area of our investment here is in research, training, and care around HIV. The second biggest is in areas like TB and COVID. And then third is supporting many programs that have to do with maternal and child health.
Okay, Dr. Gawande, you're going to be here for about a week or so, I understand. So you arrived yesterday. You've started already. You've mentioned visiting a health center, a health unit in Hillbrow, and you've been at the VETS Reproductive Health Unit. What are you going to be doing this coming week? And how, when you look back at your visit, very briefly, how would you measure its success?
Yeah, the critical thing to me is understanding how are we advancing the next stage of this work? So if survival, if the average life expectancy is now 64 years in South Africa, for the wealth of this country, that is still too low. And we know that that is about the 60 to 70% who are dependent on the public health system. And so we are looking at supporting capabilities from health financing to want the parties on all sides to be investing in the health system to enable universal health coverage. People should be able to access primary health care, afford the drugs that they need in order to live long, healthy lives.
We're running out of time, but how will you measure the success? For you, when you go back to Washington, how would you say that, how would you know you are successful here this next week?
The most critical measure of success is that I see that the people that I'm meeting in all of the programs are motivated, that they understand their job is first and foremost to enable the health workers to be successful in delivering the best possible care, and that I understand the next places that will create the most value for our investment.
Dr. Atul Gawande, thank you very much for your time and coming through just 24 hours after you arrived in South Africa. He's, of course, the head of the Global Health Program at USaid, but officially is known as the Assistant Administrator there.